Welcome everybody and greetings from Cairo. I would like to thank the Arab Women Organization, the National Commission of Lebanese Women, UN Women and UNFPA for organizing this important event. The topics of access to justice and access to care are always important, but never as much as in crisis situations, be it through conflict or natural disasters. Evidence from humanitarian settings show that violence against women and girls rises during and after crisis. Refugee camps, for example, regularly report gender-based violence, and survivors need comprehensive case management to regain health, safety and psychosocial well-being. Access to care, recovery and resilience services is therefore not optional. It is life-saving and foundational for dignity, agency and participation. Care matters first because it addresses immediate harms and barriers. During emergencies, women and girls disproportionately shoulder unpaid care work, caring for children, the sick and the elderly, while navigating disrupted services and unsafe environments. This double load limits their time, mobility and access to training or income. Gender-responsive care services like accessible health, psychosocial support, childcare, safe referrals and protection reduce the mental load, create safe pathways to help after violence and enable women to engage in education, livelihoods and decision-making. Recovery matters because crises exacerbate pre-existing inequalities. COVID-19 demonstrated this clearly. It increased risks of domestic and gender-based violence, amplified online safety concerns for children, and deepened economic and social vulnerabilities for displaced women and girls. Targeted recovery measures, data-informed services for migrants and refugees, helplines, protection programs, and women's leadership minimize long-term health, psychosocial and economic consequences. Without these, women and girls are pushed further behind, undermining community recovery and social cohesion. Resilience matters because shocks are recurrent and communities can adapt. A resilience approach strengthens capacities before, during and after crisis, linking short-term social protection and nutrition to medium-term livelihood restoration and long-term systems change. Prioritizing women of reproductive age, infants and young children improves nutritional diversity, health outcomes and household stability. Resilience also means inclusive governance, ensuring women's voices shape services and infrastructure, such as safe, equitable water management, so that solutions reflect real needs and reduce exposure to risk. Crucially, effective models exist. Comprehensive GBV case management with trained community workers in refugee settings have shown feasibility and acceptability, improving survivors' health and safety through trusted outreach, task sharing, and coordinated referrals. In crisis response, integrating mental health and psychosocial support, staff care, disability inclusion, and gender-responsive program design, like child care provision and accessible venues, raises participation and impact. The bottom line: when women and girls have assured access to care, recovery and resilience, communities recover faster and fairer. Health improves, violence declines, children's nutrition and education stabilizes, and economies rebound more inclusively. Investing in these pillars is not only a human rights obligation, it is a strategic imperative for sustainable recovery and long-lasting peace. In every crisis, put women and girls at the center of care, enable survivor-focused recovery, and build resilience that anticipates risks and transforms systems. That is how we move from coping to thriving. WoMENA, the project I'm heading, which is funded by the German Ministry of Economic Cooperation and Development and implemented by GIZ, is fully committed to support the Arab Women Organization, our political partner, in following up on the recommendations which you, esteemed participants, will develop in this meeting. Thank you.